Good morning, church.
Good morning.
So thank you so much, Daddy, Mommy. God bless you. Thank you so much. We're so lucky that we have a pastor that is looking after us, not only spiritually, but mentally, physically, and in all areas. So we're so lucky. So today, we're going to be talking about one of the topics that, is so dear to me. That's one of my specialist areas. So before we go into the topic today, we're going to talk about the objectives. So the first thing is we're going to learn about the anatomy of the pelvis. So this is a female pelvic talking about maybe. It's different from the male pelvic, slightly different. As we go, we'll talk about some of the reasons why they're different. And then we'll talk about what pelvic floor dysfunction is. What do we mean by pelvic floor dysfunction? So we're going to talk about that today. And we're going to talk about the causes. We will discuss the causes and possible intervention when you have pelvic floor dysfunction. Like I said, pelvic floor dysfunction is like an umbrella name for so many things in our system. Then we'll talk about prevention. The reason why we're here today is prevention. We don't want to get to a stage whereby something is wrong, then we need to go to the hospital. Because most of the things that we go to the hospital for, 75% of it, can actually be prevented. And that's the goal. So can I have the next slide, please? Thank you. Right, so this is a screening tool here. And the reason why I put the screening tool is because I want everybody to assess themselves. So if you have a paper and a pen, get it out. If you have your phone, get it out and go to your note. So number one question. If you have any pelvic pain at all, or whether it's your genital area, your perineum, your pubic bladder, bowel, any pelvic pain at all, I want you to put 1.
Like if you have it now or you've had it before.
Before, often, sometimes, I want you to put it down. Let's call it 1. Any pelvic pain. Number 2, if you remember falling, even as a child, on your back, your tailbone, I want you to put 1 down.
What's tailbone?
Your tailbone is here. I'll show you.
Okay,
so this is your tailbone.
Okay, if you fell on your tailbone.
Yeah. Whether your back, your tailbone, or your buttock in the past, I want you to put 1. Number 3, if you're somebody that sometimes experiences one or more of the following: accidents, loss of urine, unable to completely empty your bladder. And what I mean is when you're trying to urinate, you're passing urine and you finish and you feel like there's still something. Right? That's the second one. The third one is when you're trying to void, you go, then you come back 45 minutes later again to void. I want you to put 1. And if you have any body sensation when you're passing urine, please put 1.
That means another 1.
No, just 1 for the whole. Yeah. The next one is, I often having to urinate 2 or more times during the night. So when it's your bedtime, when you go to bed, and you have to wake up at least twice. I'm not talking about once. 1 is okay. But the moment you wake up twice to pass urine, I want you to put 1. If you're somebody that has feeling of pelvic floor pressure or sensation, or you feel like, your organ is actually dragging, or sometimes when you sit down, you feel like something is there, something is heavy around your pelvic floor region, I want you to put 1. If you have a history of lower back pain, that's your lower back. If you have history of lower back pain, your tailbone, hip pain, I want you to put 1. Or groin. Or if you've been diagnosed with sciatica pain. Sciatica pain is pain that goes from here and radiates to your leg, toes. I want you to put 1. Pardon? Where?
Like right there.
As long as you're having pain, then yes, put 1. I will tell you how everything is connected. Right, so if you're having to go to the toilet to defecate, and what I mean is passing number 2, your bowel, right? And you go and you're suffering from constipation. Constipation is not about the type of your stool that is hard. Constipation means you are having an impaction or fecal loading within your colon. It can be soft stool. It doesn't matter. As long as you go and you finished and you feel like, oh, I'm not completely empty, I want you to put one. If you have to strain when you need to open your bowel, straining means you're pushing. I want you to put one. If you have pain during sexual activities, and I'm talking about the adults here now, or sexual intercourse, I want you to put one. When you have sexual intercourse and you have back pain in your groin, in your genital area, I want you to put one. When you sit for a long time over the period of time and you start feeling you're having back pain or pain radiating from your neck down, I want you to put one. Right, so we finish. So who scored one? Who scored 1? 2? 3? 4? 5? Okay. So if you have more than 3, there's a high chance that you have a pelvic floor dysfunction. Okay, so I really want you to listen today. Can we have the next slide, please? So that's our self-assessment. Okay, church. What do we mean by pelvic floor dysfunction? When you hear the word pelvic, what comes to your mind? Can somebody pass another mic through? When you hear about pelvics, what comes to your mind as an individual? I'm going to start calling in. We all have to say something here. I'm not teaching. I'm not going to teach. When you hear the word pelvic, what's the first thing that comes to your mind? Don't read the board. Ignore it.
Honestly, I just think pelvis.
You just think the pelvis like the frame. Okay. Somebody else?
Waist.
Pardon?
Waist.
Your waist. I like that. Somebody else?
Labor.
Label. Thank you. I'm expecting to hear that. Somebody else?
Bowel.
When you hear the word pelvic?
Bowel movement.
Bowel movement. Okay. So when you hear the word pelvic, most people, they tend to relate that to women, female. And I'm very surprised that most of this female here didn't say anything. Because there's this myth, when you hear the word pelvic, people associate it with female. They're thinking about pregnancy. They're thinking about, everything female. But the truth is, both male and female can actually have a dysfunction of the pelvic. So that's number one thing. So I put it there, pelvic floor dysfunction. What does it mean? It simply means there is an improper coordination of the pelvic. So is it that your pelvic muscle is weak? Is it that there's too laxity? Is it that you're having what we call hypertonic pelvic? That is when you see people contracting instead of relaxing their pelvic, which can then create pelvic pain. Whether during sexual intercourse, whether during, that can cause problem with erection and all that. It could be due to pelvic floor dysfunction. So we're going to go deep today. So pelvic floor dysfunction is when there is a problem with your pelvic floor coordination. Because as individual, we need the pelvic floor muscle to coordinate or control your bladder, your bowel, your sexual health, and so many other things. Okay? So let's go to the next slide. There's going to be question. There's going to be question, so listen. Right. Before we go to the main topic, I decided to put that. How many of us have heard about core muscles? So we have 3 separate core muscles. And all your core muscles can actually interlink and work with your pelvic. So if there's a problem with one section of part of your core, you can then develop pelvic floor dysfunction. And pelvic floor dysfunction is not something that happens to adults. And anybody, and I mean it, anybody can have pelvic floor dysfunction at any given time. So if you look at this diagram, can I step on there quickly? Right. So if you look at this diagram, can you see that there? Your diaphragm. Who knows what their diaphragm is? Oh, I like. Did you see what she did?
Yeah, I know.
I said, who knows what their diaphragm is? Yeah, exactly. So when we're breathing, because we are sitting here now, you're looking at me, I'm looking at you, we are all breathing. Because if we're not breathing, we'll be unconscious right now. And so when you breathe, you see that your diaphragm goes up and down. That muscle that allows that activity to go up and down is the core, right? So it's part of your core muscle that controls that. And that's where your transverse abdominal is. So like he said, he's very right, that's the core muscle there. Another core muscle is what we call your multifidus muscle, is at the back. And that's why you can bend down, you can twist, you can do so many things, because the core muscle at the back supports your spine and the back. So we were asking about questions about injury before. Do you have back injury, accident, fall? If you do, there's a possibility at a later stage you can develop pelvic floor dysfunction as well. The third one is the pelvic floor muscle, which is the main one. Right. So this is what a pelvic floor looks like. That's a pelvic floor frame. That's a female one. We won't talk about the organs in here today until we get to where we're talking about organs or pelvic floor organs and prolapsing, okay? So that's your pelvic floor. Let me see if I can hold the mic and this at the same time.
I'll do that, Mike.
Thanks, babe. Right. So this is the pelvic floor frame. So as you can see, that's your pubic bone there. That's your tailbone there. All these red parts are pelvic floor muscle. You can see it's massive. And without the muscle coordinating properly, it is very difficult to coordinate your bladder, your bowel, and sexual activities effectively. And that is not the only thing, okay? All these are different organs that are within the female pelvic floor frame. So this muscle is there, is massive, is there to support all these organs to make sure that they're not falling. And the thing today is, we're not talking about organ prolapsing today, but I'm just going to mention this briefly. Every single organ within the women frame can actually prolapse. And that is very common. If you're 60 and above women, there's a high chance that you have 1 or 2 pelvic organ prolapse. Some people will have symptoms with it, other people might not do. Okay? So let's go to the next slide. Now we're starting the main section. Those are just introduction. Right, so that's the pelvic floor muscle. We've gone through that. And these are some of the function of the pelvic floor muscle. So without your pelvic floor muscle, or if it's not working properly, then you might have breathing problem because they are connected. Do you know that? Do you all know that? So that's why we need to be looking after our pelvis. Pregnancy and childbirth, if you're pregnant or you want to give birth, without your pelvic floor, that's not possible. Because you hear the midwife, they ask you to push, right? That's what you're pushing. You're using your pelvic floor. And when the pregnancy is actually there, that's the muscle that is helping to hold things in place. So if you have a baby, 1, 2, 3 babies, there's a high chance that you might have a pelvic floor dysfunction. But we're not going into that today. It's a separate topic. Okay? Pelvic organ support, we've talked about support, we've talked about bladder, bowel control, and all that. Can we have the next slide, please? Right. So these are symptoms or indicators. So if you go to the toilet frequently to pass urine, so I'm talking about you going to the toilet, you're passing urine, 45 minutes later, 1 hour later, you're going back to pass urine. That is what we call frequency. That is a pelvic floor dysfunction. We're coming to question, babe. Just write it down.
Yeah.
The second one, if you have issue with constipation, like I said, where I come from, a lot of people suffer from constipation. But what they normally do is they get some concoction or some different things for you to drink so that you can get rid of that.
Yes.
If you are somebody that has recurrent constipation, there's a guarantee that you have pelvic floor dysfunction. And the thing is, whether you're having incontinence, constipation, those are just indicators. They are just telling us that something is wrong within the organ. People don't just have constipation. If it's a one-off thing, that's a different thing entirely. But if you keep having constipation and you have to strain or push when you're defecating, there is possibly organ prolapsing or so many things that can cause that. So you might need to speak to somebody before it gets worse. It takes a longer period, but when it sets in, it sets in. Back pain, frequent back pain. That could be an indicator. When you're urinating and it's very, very painful, that could be telling you something. Pelvic pain, it could be telling you something. And most people that have had 1, 2, 3, 4, 5, 6 childbirths, they usually have pelvic floor dysfunction, like I said as well. I put something there, symptoms of hypertonic. What do I mean by hypertonic pelvic? Hypertonic pelvic are the people that have issues with contraction. So the pelvic floor muscle, for it to coordinate or control, you need to relax for it to function properly. But if you're having problem with anxiety, for example, and most people with hypertonic pelvic will have pelvic with problem with sexual intercourse as well. They will have pain. If you're having burning sensation, constipation again is showing, back pain, definitely there might be pelvic floor dysfunction. Can we go to the next one? Right. So this is very interesting. I'm going to go up there. Today we're not talking about organ prolapsing, but like I said, 80% of elderly women will have 1 or 2 organ prolapse. Over 50% of people aged 35 and above, we have organ prolapse. That is telling me that if we have 10 women here, at least 5 we have organ prolapsing. Some, they will have symptoms. Some, they might not have symptoms. And the symptoms can get worse at any particular time. So what do I mean by organ prolapse? Men do have organ prolapse too, before I go on. All right, sir. So men do have organ prolapse as well, because you have what we call rectal wall prolapse, because you have the bowel. But women have more organ prolapsing because we have extra organs for reproductive purposes. So we're talking about, what do you think it is?
The womb.
The womb, thank you. Somebody else? Women?
Fallopian tube.
Okay, women? Not you again. Uterus, thank you. Yeah? Another one. Ladies, I expect everybody to say something. Organs. There's uterus. There's vagina. I know some of these things, nobody wants to talk about it. Because you think we're in the house of the Lord, there are some things that you shouldn't mention. But if you can talk about your heart or your head and tell me that, oh, my chest is paining me, you should be able to talk about this. Because they are as important as every other thing. So we are educated here. So we're talking about your bladder, we're talking about the bowel, we're talking about uterus, we're talking about vagina. All these organs can actually prolapse. Your larger colon can prolapse, which is the larger bowel, and the smaller bowel as well can prolapse. And that is why you see that men too do have organ prolapsing. And most men, when they have problem defecating, that is when the problem is. So women, let me just show you this quickly. So this is what the normal anatomy is. So that's the bowel here, it's always at the back, right? That's the uterus there, and that's the vagina there. I hope you know that your vagina is not your vulva. We'll come to that at a particular time, ladies. And that's the bladder there. This is women anatomy. If you look at this picture, you can realize that the bladder has now left that position and is falling down. That is what we mean by bladder prolapse. Some women will notice that when they are looking. And I always tell every single woman, do you actually look at your private parts? Because you should be doing. That is how you can know when something goes wrong. You should be doing. And your partner, if you're a married woman, I expect your partner to check as well. Because this saves lives. I've seen a lot of people that it is their partner that picked up something different. And that saves them. Whereas we've seen so many people dying. And they do have partner. But things were changing and they didn't pick it up. Because either we're too shy or we don't discuss things with our partner because we're too holy. It is very important, please. It is very important. If you look at this, you can see this is a rectal wall prolapse, which men can easily have as well as female as well. And that is the womb. You can see the womb has actually gone down. So that's the womb prolapse there. Hysterectomy, if somebody has a hysterectomy, you won't be able to see the uterus anymore. And most ladies that has hysterectomy, which means total womb removal, this can be done due to so many reasons. Some women will have what we call endometriosis, right? Some women will have so many things going on there, and they will have to remove the womb and everything, total hysterectomy. You can do partial, but the truth is this can contribute to pelvic floor dysfunction at a later stage. Whether you're a man that you're having pelvic floor surgery or gynecological surgery, you can have pelvic floor dysfunction. And that is why we need to be aware of all these things. They are very, very important. And like I said, it's not by age. Anybody can develop this at any particular time. Can we have the next slide, please? So this is the pelvic organ I've shown you before. If you look at that, for male, we have the prostate. How many of the men here knows what their prostate is? Your prostate is a gland. Your testicle, your scrotum has nothing to do with your prostate. They are separate. And this is why we really need to be aware of all these things. Because if something is wrong with your prostate, and if you don't know where the prostate is, how are you going to go to the doctor to present and say, oh, there's something wrong within my prostate? And the truth is, between 1 and 2 black people, whether you are a Caribbean man or African generation, they are prone to have prostate. So if we have 30 men in this room today, I can guarantee you at some point, about 15 to 18 might have prostate issues. It is hereditary. It's very common among black people. So if you're here, you are above 40, but your prostate is not your testicle, your prostate is not your scrotum vein. But the prostate is directly on top of your bladder. It's a separate thing to your bladder. And when people have enlargement of the prostate, they can have so many symptoms that we're going to dive in. And that is why the pelvic floor is so complex. It's so complex because one symptoms of one thing can actually mimic the symptoms of another. So some people will have prostate cancer. They will have similar symptoms to somebody that has UTI, which is urinary tract infection for a man. So all this we need to know. So let's go. We've talked about the women part, uterus, your vagina, your bladder, your rectum, and all that. Can we go to the next slide, please? Right. Can you see that anatomy there is the male anatomy? It's different from this. Can you see the difference? Can you see? Not clearly. Okay, I need to be careful. I'm going to go. So that's the male anatomy. You can see that's the male rectum there. Male don't have uterus, so that's missing there. They don't have vagina, so that's missing. You can see the male bladder there, and that's the prostate there. Can you see the prostate? And your prostate is not your scrotum. That's your scrotum there. So they are two different things entirely. So we need to know all these things. It is very key, and it is very important. That information alone can save life. Right. So every year, millions of men around the world are diagnosed with pelvic floor dysfunction. And I'm not talking about organ prolapsing here. I'm not talking about pelvic floor prostate cancer. So men, usually when you're having all this burning sensation when you're passing urine and all that, it could be an evidence that you're having prostatitis, an inflammation of your prostate. It might not be prostate cancer. It might not be, it can be prostatitis, and that is very common with men. And a lot of men, when they have all this problem, they do underreport. They don't report it, especially African, Black, Caribbean men. Evidence has shown that. Until something is really bad, you will not see them. So by the time you're seeing people from the African, Caribbean descendants having urogyne problem or gyne problem, trust me, that thing is really bad. That is when you're thinking about, okay, you know what? We will just be managing you till you pass. Which is very sad, because the truth of the matter is 75% of this can actually be cured, prevented, or treated. So can we go to the next slide? Can you go to the next slide, please? Now, ladies, we are here. So that's the anatomy of the female. Can we see what is there? You can see the bladder there, the uterus, the vagina, urethra, everything is there. And like I said, pelvic floor dysfunction is very common among ladies. Who can guess how many percentage of age 15 to 30 will be affected by pelvic floor dysfunction? I want somebody. Between age 15 and 30.
25,
35.
20,
20.
25.
I think it should be 50. I think it's so 86.
I'm talking about age 15 to 30. 25 is 30. 30%. Which is quite very, very high. And we're talking about a group of people that most of them have not even given birth. If you think about pelvic floor dysfunction and what we've talked about, we're talking about people that have not given birth. They've not been pregnant at all, but they're still having 30% of that cohort having pelvic floor dysfunction. So that is telling you that there are so many reasons or causes that people can develop pelvic floor dysfunction. Right. So women between age 40 and above, how many percentage? 40. And women between age 50, 55 and above, how many percentage?
70.
Over 70 plus. So it is very, very, very common. So if you are an adult here and you have parents that are over 70, 65, you need to be asking them some personal questions because they might need help. And these are things that we don't discuss. These are things that we don't talk about. But it is very, very important. Okay? So can we go to the next slide, please? Right. So we've talked about this. Age can be a contributing factor as we're growing old. We tend to have laxity with, waist muscle and all that. So age can be a contributing factor. We've talked about pregnancy and childbirth. Genetics. Some people are born with what we call slow transiting. We're not going to go into that today. Okay, so genetics can actually contribute to pelvic floor dysfunction. Hysterectomy, like I said, any gynecological surgery, any pelvic surgery can be a contributing factor. Okay, pelvic injury, abdominal pressure, constipation, right? Those of us that goes to the gym, we like to, gym, weights. We want biceps. Seven packs, is it 7 packs or 6 packs? Yeah. If you're doing it and your technique is wrong, if we're doing it and the technique is wrong, we can develop pelvic floor dysfunction. So we need to be careful. Especially those people that lift weights. When you're lifting weights, ensure that you're not putting pressure on your pelvic floor muscle. Because if you're bearing down, there's a chance that you will have pelvic floor dysfunction at a later stage. I see a lot of trainers in the clinic.
So,
very, very common.
So when they put that dumbbell on here and they're doing the hip thrust, they say...
So when you're doing that, the moment you're going down, you need to be able to pull your pelvic floor muscle up. Every single time you're going down, you pull your pelvic floor muscle up. Because if you're not doing that, you're putting pressure on your pelvic, which can cause organ prolapsing. And this is very common. And like I said, a lot of trainer comes to my clinic. A lot of trainers. They are suffering from pelvic floor dysfunction. So all these things is about techniques. Is key. So don't just go to the gym because you want to go to the gym. You need to learn some of the right techniques. Because if not, we're going to be having problem. Obesity, weight can cause it. And history of back pain as well. Black men, prostate history is very common. So please don't take it lightly, okay? Your GP can either do a DRE for you, which is digital rectal examination. We do it every single day. Basically, they put a finger, go into your rectum, and they can feel the prostate. If it's large, we know, okay? And they can do a blood test. It is very common. If you are 40 and above and you're a black descendant, please ask your GP for this test. Let's go to the next slide, please. Right, so I want to talk about briefly about urinary incontinence. Okay? When you hear about urinary incontinence, what comes to your mind? Urinary incontinence is just tiny fraction of pelvic floor dysfunction. It's a symptom that you can see. What do we mean by urinary incontinence?
Loss of bladder control. You can't control.
Thank you. It's loss, involuntary. Because with your pelvic, you should be able to control when you want to pee. So if you're a woman, you cough, you sneeze, you jump, you run, and you leak tiny as a drop. That tells me you're having a pelvic floor weakness. Okay? So when you sneeze, cough, run, jump, and you leak, no matter how tiny, that tells me you have a weakness to your pelvic. I'm not talking about pelvic floor organ prolapsing, but I'm telling you about pelvic floor weakness. And that can be easily corrected by a couple of things. Exercise, for example. But you need to know how to do them. And that's why you need to speak out on these things. So there are different types of urinary incontinence. We're not going to go into it deeply. So we have urge, stress, and all that. Can we have the next slide? Because I'm quite with our time now. Right. So they conducted a survey recently. Yeah, they sent the report to households. And they sent it to over 45,000 households. And the result that came back from that, 37% of the people were saying, oh, in the last 2 months, they started noticing that they're having urinary incontinence when they cough or sneeze or jump. So that's just to tell you how common that could be, right? So that's his incontinence fact. We have so many facts of the incontinence that we've talked about today. I don't want to keep us too much on that. And the truth is, it's underdiagnosed as well. Because a lot of us, we keep things to ourselves, especially when it has to do with reproductive organ, sexual things, we keep it to ourselves. Please don't, because it could be something really serious and it could be something minor. And please, for those people that, people will tell them, oh, I'm having this, oh, they will diagnose you and say, oh, it's UTI. When I have that symptoms, I use this antibiotics, go and use it. Please don't. Please don't. And the reason why I'm saying this is, I've had encounter of so many ladies that have actually passed on. Right? Because what they were having at that particular time is either ovarian cancer, cervical cancer, and people are giving them antibiotics because they are diagnosing themselves as having UTI. Oh, I've had that symptoms before. This is what my doctor prescribed for me. So people start using antibiotics. And when you use antibiotics, it will mask the symptom. And every single cancer, if it's caught early, 75% of it is treatable. 75. And it's very, very painful when you see that people passed on easily on things that could have been treated. So please don't ever, when you have a symptoms, please report it. And ladies in the house, get into the habits of knowing every single organ that you have. Use your mirror. If anything is changing, please speak to somebody. It is very key. Okay? Let's go to the next slide. So is it normal to leak?
No.
Thank you. No matter how tiny, it is not normal to leak. When you leak, that could be a weakness to your pelvic, and it could be a sign that you're having pelvic floor dysfunction. Can we go to the next slide, please? So, impact of urinary incontinence. Remember, we're just picking something, just one thing out of the whole thing. So, the impact could be psychological. It could be social, domestic. It could be, occupation. I see a lot of staff that we work together. In fact, I see a lot of consultants. One consultant was referred to my department. She wouldn't come until she had an accident while looking, while assessing a patient. And that was really horrible. So this is very key. Whether it's your bladder, whether it's your bowel, no matter how tiny you think you can manage, the moment you notice something is not right, please speak out. Men, women. When you have to strain, you have to push to defecate. When you're peeing and you feel like you're not empty completely and you have to go back again often and often, and your pee is not between 2 to 3 hours, you wake up in the night, more than 12, 2 times, please speak to somebody. Okay? So let's go to the next slide, please. So the stress incontinence that we're talking about, if you look at that picture there, you will see that there's an involuntary leakage of urine. So if that person sneezes now, there might be a problem. For women that had babies, if you have 3rd-degree tears during childbirth, or 4th-degree tears, or if they have to stitch you up, or if you have some damage with your sphincter, please let somebody know, because you can be prone to having a dysfunction of the pelvic at some point. Next slide, please. So that is just to show us what happens with urge incontinence. Urge incontinence is basically you contract suddenly and you need to pee. So it means when you need to pee, you have to. Some people are like that, whether male or female. So if you have that urgency, then that is urge incontinence. It's different from stress incontinence because we have different types. Okay? So if you have all these indicators or symptoms, please seek help. Can we go to the next slide quickly, please? Right. So urge incontinence, I said, is different from stress incontinence. If you are somebody that has multiple sclerosis, be diagnosed before, or if you are parents, or age-wise, or stroke, accident, back injury, genetics, all these are contributing factors. If you know anybody with all this history, the chance that they will have or suffer from pelvic floor dysfunction is very, very high. And this is why we need to start talking about all these things. So next, please. Right. So there are treatment, like I said. We won't go into them in details. We have what we call conservative management, okay? We have physical therapy, we have behavioral therapy, we have medication in form of treatment. So there's so many things that we can do to help when people have pelvic floor dysfunction. And this is why that I always say, please report. We do under-report, especially the black community, we under-report. By the time I see 100 white people in the clinic, probably 70 Asian, Indian, you might see 5 black. And it's not because we're not having this problem. It's just because we keep things to ourselves, and by the time we're reporting, ours is always worse. So if you have any issue around your pelvics, please, 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 and please, I can't stress it enough, please report or seek help. Can we have next slide, please? Right, so I put that there. That's actually my whole product. That's Pelvtone. This is a Kegel ball for people that have pelvic floor weakness. So if you're sneezing and you leak, or you run and you leak, it might mean that you have a pelvic floor weakness, which you can tone up with a Kegel ball. And I have a booklet that I did. It's like 2 pages. I did one for men and women. If you go on my website, you can download that free. And please just do that, unless you are having hypertonic pelvic. And people with hypertonic pelvic, it means you're contracting or you're always having pain within your pelvic floor. So the exercise that you will need will be different from normal exercise. But most people generally should be toning up their pelvic floor muscle, especially if you've had children in the past. Can we go quickly? I think we're almost done. Yeah, that's another thing. This is an underwear, for people with heavy period or people that leaks. It's just like a prevention thing. Because most of my patients, but like I said, pelvic floor dysfunction is very, very common, and it's something that we really need to, to pay attention to. Any question? Yes?
What are the causes of prostatitis?
Prostatitis infection. Yeah. So it could be inflammation, okay? It could be just inflammation. And prostatitis, you can have prostatitis due to bacteria infection. Some people can have prostatitis due to sexual practices. Okay? And like I said, if you have UTI, before I forget, if you have urinary tract infection, please don't self-diagnose and don't self-treat. Because with women, most women that didn't treat their infection properly.
So I want you to answer that question again.
Okay, sir.
My question is causes of prostatitis.
Yeah, prostatitis is an inflammation of the prostate, like I said, okay? And it can be caused due to bacteria as well, and other sexual infections. So we need to be careful as men. If you're having painful urination, burning sensation when you're passing urine, it could be inflammation of your prostate, which is prostatitis, and is very, 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 very common. Okay? So women, ladies, like I was saying before, if you have UTI, men, if you have UTI, this is one of the commonest reasons why people have fertility problem. Untreated UTI. So most ladies that have a fertility problem, up to like 40%, is not because they are promiscuous. It's because they've had some infection at some point in their life that have been left untreated. So please, we need to be careful and we need to be sure of what's going on, and we need to get the right treatment. So if you know anybody that is suffering from fertility, it might not actually be anything wrong with them. It could be because of the fact that they've left untreated infection and is, contribute to that. So 40% of people are actually having infertility problem because of that. So it is very key and important. So thank you. Any other questions? Yeah.
Sorry, you said something like there's nothing like 2 minutes, man. And you said something like it's due to ignorance of what's particular.
Okay. So there's nothing like 2 minutes, man, like I said. If somebody is having erectile dysfunction, it could be that their pelvic floor muscle is not working effectively. Whether it's really weak, okay, or there's a damage around that area, okay, as a result of pelvic floor dysfunction. And this can be treated with either of all the treatments I've mentioned there, depending on an individual. But we as an individual, we've termed it, this person is a 2 minutes man because they can't retain erection, or it's very difficult for them to maintain an erection. So that is a dysfunction of the pelvic or other causes, not necessarily that terminology of saying somebody has 2 minutes man. It's ignorance. It's because people don't know. Because if you are aware and you know, then you will know that that person is actually, it's just like somebody have a chest pain or heart problem or head problem or chest problem or back problem. Is almost the same thing. So there's nothing like 2 minutes man. Next person, please.
And with the frequency of using the toilet, what if you drink a lot of water? How do you tell the difference between pelvic dysfunction?
So when you said a lot of water, how many water are you talking about here? How many liters?
No, like 2 liters a day.
So if you're having 2 liters a day, which is the normal amount that we expect you to be having, you shouldn't be having frequency. So if you're having frequency, that's telling me that there's a possibility that you're having pelvic floor weakness.
What if it's more than 2?
If it's more than 2, that means you're having pelvic floor dysfunction, pelvic floor weakness. Okay? And there are so many things that could cause that. Like I said, some people are born that way. We can't go into that today. But when we're talking about rectal organ prolapsing, which is common among women, we will go deeply into that. Okay? But definitely that's a symptom. Anybody else? Yes, sir.
Yes. At times when I'm driving, I can hold it.
Okay.
So later, I say, once you have the urge, push it.
Okay.
So at times, I take like up to like, I think 4 or 5 liters a day. I drink a lot.
You drink a lot?
So,
okay.
And I don't have no sensation or nothing, and I peak like that. But at night, then maybe at night, at times when you eat,
yes,
you want to burn down your fat and everything. Yeah, I take a lot of tea.
Okay.
So I try to
reduce that.
At times, I go like twice to toilet. But once I feel the Thank you.
Thank you, sir.
I want to add something about that. I'm somebody I drink a lot of water.
Okay, sir.
So and at a point, I met a doctor. A friend was telling me it's not good for a man to hold it for long.
Yes.
At times when I'm driving, I can hold it.
Okay.
So later, I say once you have the urge, push it.
Okay.
So at times I take like up to like I think 4 or 5 liters a day. I drink a lot.
You drink a lot. Okay.
So, and I don't have no sensation nothing, and I peak like that. But at night, then maybe at night, at times when you eat,
yes,
you want to burn down your fat and everything. I take a lot of tea.
Okay.
So I try to
reduce that.
At times, I go like twice to toilet. But once I feel the urge, I got no sensation nothing.
Okay.
But I drink a lot of it.
Okay. So in terms of frequency, sir, how often do you, when you go to the toilet to pee, for example, do you go after like an hour, or it takes about 2 to 3 hours?
It depends. Like maybe when I sleep late, maybe I'll do like 3.
Okay.
Then I do like 6 or 10, 7.
Okay.
Bring them up to that.
Okay. So We'll talk later. There's a possibility there's something. Okay? But when you need to pee, like he said, you need to go. And that is very applicable to students, most especially some of you that are students, that you go to school. You need to defecate, you need to pee, and you have to hold it because you don't want to use the toilet. If you do that over the years, you can cause miscoordination. And before you know it, you start developing pelvic floor dysfunction. So you need to be careful. What you need to go is a call to nature. It's not something that you control. Because if you keep controlling it and withhold it, you might lose sensation, then you can start having issue with incontinence at some point. So we need to be careful. Okay? Next person, please.
Hi.
Yes, ma'am. Yes, mommy.
You don't want us to leave this.
Okay, so I just wanted to ask that for ladies,
Yeah.
if we hold our pee intentionally, does it have any side effects?
Oh, yes. You shouldn't be holding your pee, and that's what I've just said. When you need to go, you need to go. Okay? Because when you're doing that, you're passing a wrong message. Your body is telling you your bladder is full, you need to empty. When your bladder is full, when you need to empty, you need to empty. If not, you might lose that sensation, and that will become a bigger problem in the future. Yeah? Yes, ma'am. I'm coming. Yes, ma'am.
Any correlation?
Oh.
Is there any correlation between pelvic dysfunction and diabetes?
Definitely, 100%.
Because I know that people who are diabetic, they go to toilet
More often, yeah.
More often. So I just want you to.
Most pelvic floor people that have pelvic floor dysfunction, most diabetic patients are prone to have pelvic floor dysfunction. It's very common. Okay.
Does that with the diabetes thing? Yeah, does that mean they have more of that urge incontinence?
It could be any.
My question is, after urinating,
Yes, ma'am.
and you are having pains in your body, you can't lie down straight away after coming back from the toilet. What is any?
Okay. Mommy, that could be a pelvic floor dysfunction. Okay. It could be as a result of you contracting your pelvic. Instead of your pelvic relaxing, that is more attributed to people with anxiety, tension, stress. So if you're stressed, if you're not rested well, that could cause that. So instead of you opening your bowel, opening your bladder and shutting, then you start contracting. So when you're contracting, that can cause pain. And that could be another thing as well. So there are so many things that could cause that. It could be that you have one or two different organ prolapsing. It could be bladder prolapse, it could be bowel prolapse, it could be any kind, but those are symptoms. Okay?
Yeah, just one question.
Go on.
Is there any correlation with we ladies, because we get our period and we get back pain? So is there...
So if your back pain is related to when only you're menstruating, that's a separate thing. But if you're having back pain aside that is another separate thing. Back pain could be an indicator to so many things. When people have ovarian cancer, they will have constant back pain. Remember, your ovaries is within your pelvic floor. And like I said, everything is related. If you have kidney problem, you can have back pain. And this is why you don't just sit down on things. It could be kidney, it could be kidney stone, different things. So we need to be cautious. Okay? But if it's just only when you're menstruating, don't worry about it. Okay? Thank you. Anybody else? So thank you very much, and I hope we've learned. Thank you. God bless you. Thank you, Daddy.
Thank you so much. May the Lord continue to bless you in Jesus' name. More grace in the mighty name of Jesus. Let's read the book of Jeremiah 17, verse 14. As long as, thank God for this church, CAC Church, we believe in divine healing without medication. But we thank God things are changing because we believe that the pastors are gifts from God, so doctors are gifts from God. So we have to appreciate. And in our Bible study last week, we saw Dr. Luke that followed Apostle Paul during his missionary journey, and he gave advice to Paul, and Paul transferred to Timothy that he should be taking little wine. That's a medical, advice, which is very good. I was with my senior pastor, my principal when I was in Bible school, and he told me what ìwòsàn láìlóògùn has caused him. We are not going to that. So please don't let us take anything for granted. I said to us, Ọlọ́run ò ní kòkó lọ́run tó fẹ́ kọ́ wá ṣá, kò sí iṣẹ́ IT tó fẹ́ lọ ṣe lọ́run. No banking system you want to go and do there. Do whatever you can do here. Enjoy yourself and make heaven. I know how many of us want to make heaven? How many want to live long? That doesn't mean that someone cannot die prematurely, but let us try our best what we think we can do. The book of Jeremiah chapter, what did he say? Sometimes we can be having all these things and we keep on going to the doctor. Doctors, they say they have not discovered anything. Until relate. You keep on doing tests. How many of us have done that? But you say, my test, one hour ring. Oh, what are ring? You are talking about ring. Let us read that Jeremiah 17:14. What did he say?
Heal me, O Lord.
Heal me, O Lord. And I shall be healed. Save me.
And I shall be saved.
Let us close our hearts and begin to pray. Lord, heal me. If there is anything that they cannot diagnose, anything they cannot figure out, or anything that I cannot even pinpoint that this is what is wrong with my life, Lord, heal me. And I shall be healed. Open your mouth and begin to pray that prayer in the mighty name of Jesus. Pray that God heal me. Heal me, Lord. Heal me, Lord. Heal everyone in this auditorium.